Hi, everyone. Thanks for joining our webinar today. My name is Mel. I'm the marketing director at Medcurity. I have a guest with me today, Jennifer Oelenberger. She's the president of EHR Concepts. They are a partner of Medcurity's, and I will let her introduce herself and take it from here.
Hi, everyone. Thank you so much again for joining. Thanks, Mel, for having me today. I'm really excited to give back to you all, just share a little bit what's going on in the MIPS landscape. We all know throughout the year, we're preparing and we're getting things done and we're starting to look at our numbers and things, but we just wanted to give you a little bit more of information about MIPS. Just a little bit about me and EHR Concepts. Again, I'm Jennifer Oelenberger, president of EHR Concepts. Have been with the firm for many, many years, going on 14 years, where we provide services, consulting services, managed services, support fractionally or full-time in a help desk capacity to help healthcare organizations with their EHR and their practice management solutions. So happy to share with you a little bit about what we do today around MIPS, but really just to give you information about MIPS and help you prepare. So what we're going to cover today is really just an overview again of MIPS. You probably know a lot about it, but how to master each of the categories, how to avoid some mistakes and downfalls that you may not be thinking of, streamlining your workflows today, and then some tips. And then Mel's going to cover some things specifically around the security risk analysis and what you need to be doing and how to prepare and make sure you're successful there and avoid risk. So looking forward to getting started. So as you know, MIPS has been around for meaningful use. It's been around for some time now, and it has started to change a little bit and become more about what you're doing, less incentivizing you, more penalizing you, or staying neutral to a penalty. And so in 2025, it did change just a little bit with the percentages that you need to meet in the four types of performance categories. 30% of it is related to quality, 30% related to your cost measures, and then 25% on your promoting interoperability around your EHR, and then 15% of working towards your improvement activities. And so when we look and break each one of these down and what you need to do in each one of these categories, it's important to start looking at what you're doing in each one of these. From the quality perspective, we've been reporting quality measures now for many years. A lot of that information they're getting from your claims and other items, but you really need to make sure that throughout the year that you're looking at your measures per your specialty. Sometimes it is really hard to get, if you're in a unique subspecialty, a small subspecialty, urology, some of those harder ones that are hard to meet certain measures. Everything doesn't apply to you, right? You can't just do the common things that we've all been doing throughout these years to get credit for those measures. And so start looking at your reports to see how you're leveling up, where your downfalls. If you don't have enough data in a certain measure, you're going to have to look for others. And so sometimes when you think of quality measures, if you're not meeting the mark, you may want to consider joining a registry. Registries are things, there's a whole list of registries out there on the CMS website that you can actually, and we've dropped the URL towards the ends of the slides that you can go and find that. But there's registries out there that you can join and partner with so that you can meet this measure with ease. You don't have to rely on data that's coming out of your EHR system and your PN system to meet that. So if you're starting to look at those quality measures and you see that you're not meeting the marks, consider looking at a registry and joining it. I know we're halfway through the year, but it is not too late. There are registries that can get you spun up very quickly and get some data for you and your organization so that you can meet that with ease. So if you're not already monitoring that, look at your data. If you're missing the mark, look at the registries that are out there. With cost, Look at what's driving these reports. Sometimes there's technical glitches that's driving this. Sometimes the right information's not getting there to identify it. So you want to make sure that you're looking at that data correctly and you're getting the right information. And then if you are and there's still gaps, then what can you do from a care coordination standpoint to increase the results that you're getting from those measures? Number 3 is promoting interoperability. So we know this is a huge part, even though it's only 25%, it is a big part because it's everything related to your EHR. And this is where from EHR Concepts perspective, we can really make sure that you're meeting this measure with ease, looking at what you're doing in the EHR, how you're utilizing it. Is it configured correctly to show correctly on your reports? Sometimes it's technical. So let us make sure, or you look at that yourselves and make sure that your measures are an active reflection of what you're doing at your clinics. A lot of your healthcare providers are doing these things already. They're e-prescribing, you've got a bidirectional interface, you have all these things already set up, patients are accessing their portal, you're getting that information. Make sure that you're actually capturing that. So if you have any issues with that, just let us know. And then performing improvement activities. So as we know, Medicare wants us to get better and better each year, right? So they're saying, what are you doing today that you could do better on? And so starting to look at those activity measures, seeing some of those that you can get bonus points for, that is what we want to do in this time. We know that right now, those adjustments, if you get a negative score, say you don't meet these percentage thresholds, the negative adjustment can be up to 9%, which is a lot. 9% is a lot of your reimbursement that you should be obtaining. So making sure that we're meeting these measures at least net neutral so that you're not taking a hit on any of your Medicare adjustments. After that, then there is room for incentives still. They didn't take that all away. You can still get up to some positive adjustments, up to that 9% if you're going over and beyond. So that's when looking at your measures, especially if you're doing some of the things that are extra that you can earn bonus points for and try to work towards those positive incentives. So we'll go to the next slide and really talk about avoiding mistakes. Some of those things that I've already mentioned, but we are now in most healthcare organizations are in our 90-day reporting, or I'm sorry, our 180-day reporting period. And so with that, this is the time that we need to be measuring and watching and completing the activity items that are on there that we need to complete to be successful. So you have to do that within your reporting period. So now's the time to make sure that you're monitoring those things and we know what has to be done in these periods. And one of those is some of those security risk analysis, the safer guide, some of those things you have to do within this period. So make sure you're not missing deadlines. That's important. Look at your measures, look and see where you're at and see if all of those things that aren't necessary data measures, it's just yes, no's that you're completing those within the time period. Look at those benchmarks. What do we have to make? Some of those items are you only have to do one during the reporting period. If you don't do over a certain threshold from a denominator standpoint, you only have to have one numerator. So make sure you're doing that within your reporting period and you're meeting with your providers, especially in those promoting interoperability measures, that you're going ahead and doing that during this time. And then don't ignore the data that you're seeing. If your data looks bad and you're like, it's probably okay, it's probably just a system glitch. No, we need to look at that data. We need to look at your reports and we need to help you be successful. So don't just ignore those. That sometimes some people thinks it'll just kind of wash out towards the end of the year. But then what happens is you don't have enough time to catch up and get your numbers back up to the thresholds you need. So definitely don't ignore those. What you can do now, obviously, is double check your eligibility and your participation status. If you haven't already done that, most of you probably have, but double check that. And then again, we're going to validate the tools, the reports, and use the tools that are out there on CMS's website. So that's really helpful information to make sure you're not avoiding anything that could cost you mistakes. So the next slide, yep, there we go, is really streamlining. So if a lot of those EHR measures are impacted by clinical workflow. And is there anything that you can do today to streamline that workflow? We know that providers are working extra hard to try to meet these measures. Clicking a box and things is not always what they need to do to provide the best patient care, but they need to do to get the reports to work correctly. So, how can you streamline that workflow to ensure it works with their clinical operations and still satisfies your reports? So, making sure that the workflow that they're doing is being captured in a report. There are things that your EHR can do to make sure that the data points are connected. They can do things inside of your notes. They can do things inside of your orders. They can do things inside of the system to make sure it captures that. So automate that as much as possible. Standardize the workflow so that you ensure that they're meeting that measure. And then what are we doing to make sure they meet that measure? So as you start monitoring this information and you're seeing some of those downfalls, what is it that you can do as a healthcare organization to get that information out to them quickly? A lot of times providers don't even know they're not meeting a measure and they're not satisfying a workflow because they think, well, we got trained on it one time. I think this is how I do it. Sending out quick training videos. What can you do to say, okay, these are a couple of measures that we're kind of staying a little bit on the negative side or maybe on the neutral side that we want to improve upon? Create quick videos, quick training modules that you can send out. We all know that we learn best with micro size information. So something that we do at EHR Concepts is we have a whole a learning system, and we actually produce these little bite-sized videos that we work with healthcare organizations and say, what do you need to communicate this week to increase your quality measures? What do you need to communicate this week just to notify them of tips and tricks? And create those little videos and send those out to all of your providers to really automate that and streamline that workflow is huge. That way, as you're going throughout the month and you're tracking that data, after you send that training out, you can see those numbers go up. And that'll help you improve your scores as a whole. Other tips and items that you can do for this year is, of course, we've already talked about planning. Planning is huge. Making sure you're reviewing everything and you're planning. You're selecting measures that make sense for your specialty. Choose ones that align with you. Don't have your providers trying to jump through hoops and meet measures that doesn't make sense for their clinical workflow. Choose their clinical relevant measures that make sense. And if you don't have enough to choose from, consider joining a registry. Make sure that your data is accurate. That is a huge part of this process. Like we talked about, is just making sure that what they're doing is reflected in a report. And sometimes there is technical glitches. There's the technology changes all the time. We get upgrades, things happen to our EHRs, and then some data point gets dropped. So making sure that we're reviewing that. The fourth one is obviously using the certified EHR. All of you are probably already doing that, but make sure that your EHR that you're using is certified and ready. Your EHR vendor can help you get a lot of the information that you need. Some of the items on the Safer Guide and other things ask you specific questions about the EHR. If you don't have the answers, obviously you can ask us, you can ask Medcurity, but you can also try to ask your vendor. There's things about their technology that they have documented that they can supply to you. Engage your entire team. So thinking about it from, this is a clinical process. These clinical measures and patient safety things, this all goes into clinical workflow. So having a clinical lead help you. Oftentimes it's a nurse manager or a clinical manager that you're working with from the IT standpoint to relay this information back to them and let them know that, hey, we're not meeting the mark on these measures. We're doing poorly here. How do we communicate that well? What workflow makes sense clinically? And so working with a team of folks to do that is important, and everybody working together to get your numbers up. Number 6, taking advantage of those bonus points. you can add valuable bonus points of things that you could probably implement without that much extra workflow for your clinical staff or providers that could get you some positive points. So look at those and evaluate if that makes sense for your organization. Making sure that you're evaluating those high cost areas. If you have care coordinators, engage with them to look at those items and see if you can improve your scores there. Don't miss your deadlines. If you have any questions about deadlines, if you think, I'm not sure if we're going to miss it or not, contact me after the call. Happy to get on a call with you, ask you some specific questions, have one of our MIPS experts on the call so we can make sure you're not going to miss any deadlines and you're prepared for your 2025 reporting period. And then utilize the tools that are available. There's a lot of free resources out there. There are a lot of information on the CMS's website and the QPP site. Go out there, do your due diligence, pull up those guides, read them. They're fairly simple to find and navigate. It is a lot of information. It's overwhelming. But if you ever feel like you're not, you don't have the skill set there on your team, we're happy to help that. So that is really what I wanted to share around the tips and tricks. And I really want to I'll give you this slide afterwards. We can send it out, but these are those resources that I was talking about, the registry links that you can find, the QPP site to make sure that you have that information. But I want to pass it over to Mel because one of the biggest pieces that healthcare organizations have to tackle is around their security risk analysis and those safer guide things and making sure you're prepared for that because there is a lot of things that you have to do as a healthcare organization to attest to that you've done, and you don't want to miss the mark there. So Mel, I will pass it back to you and let you kind of share a little bit about what you can do there to help them.
Great. Thank you so much, Jennifer. All right, so I'll just move on to the next slide. So we'll talk about why the SRAs matter for MIPS. It not only is it a mandatory requirement under the quality payment program, it's also fundamental measure and it'll have a significant impact on your overall MIPS score if you do not complete it annually, and you could receive a 0 score for it in the entire promoting interoperability category, which would lead to a substantial reduction in your Medicare payments. And when you do conduct your SRA, you do want to make sure that it covers all of the safeguards, the technical, administrative, and physical. A lot of times, IT vendors who offer the SRA will only cover the technical safeguards, and people will be thinking that they're covered and that it's actually a compliant SRA, but that's not the case. It does have to cover all of the bases, and it's important not to view it as just a checklist. It's the foundation for all of your HIPAA compliance efforts and protecting PHI, making sure that or reducing your risk of breaches and any of those ransomware cyber attacks. But when you do conduct your SRA, it does need to be conducted annually and during the MIPS performance period. And then when you do think about it, I'd make sure to address the security of your PHI with your EHR technology and make sure that you have documentation to show evidence of the plan and that you've conducted it. It's not just about finding problems, it's that you have a plan and that you're taking action to correct any security deficiencies. And when you do think about conducting your SRA, making sure that you do it thoroughly, that it's well documented, and that because it is an all or nothing requirement, so you've either done it or you haven't for that performance year, and there's no partial credit. So if you started it too late or something and you weren't able to finish it, you would have to say no in your attestation measure. Is there anything that you would like to add to this at all, Jennifer?
I was just going to say some things too around the HIPAA compliance that maybe you find when you do your assessment. If there's training elements that you need, that's something that we could help with. If there's a training element that you need to provide a certain course or things like that. So if that's a gap at your organization, just let us know. There's resources that we have for that.
Yeah, thanks, Jennifer. The training is a big part of, or especially important with HIPAA, and just making sure that um, you don't have a breach or a ransomware attack or anything like that, because that your team is the most likely, I guess, like the human errors and things like that end up resulting in a fair number of breaches and things. So I'll go on to the next slide. So here are some actionable steps to take. Just make sure that you have your SRA for 2025. If you haven't done it yet, or you're partially done, just work on it, get it done. Especially if you haven't done it yet this year, just get it started right away, because it's not a process that just takes a few hours, and you want to make sure that you do it thoroughly and cover all the bases, not just for MIPS attestation, but it's a it sets a foundation for all of your security, and gives you it will help you catch any sort of gaps in your compliance efforts and in your security before a threat actor does, if you're really diligent about it. And then make sure to document all your findings and any corrective actions, and then stay updated on the HIPAA and MIPS requirements and changes. I'll mention those towards later on. There are some proposed rulemaking from the HHS regarding the security rule. So that's something to be aware of. And just taking advantage of available resources and tools. This is a screen or photo of our platform. It makes it a lot easier to just keep track of your efforts. There's a dashboard there, and you have all of your SRA management in one place, and it's really easy to create documentation rather than a spreadsheet. So I just want to share that with you. So I'm not going to go through all of these in detail, but just to give you an idea of the scope of it, it is a comprehensive process to do it correctly. And in the OCR's eyes, um, not doing it thoroughly and accurately it's just they'll take it as you haven't done it at all, because it's such a critical component, or critical thing to do to protect your organization against breaches and just healthcare in general. But yes, you start with the inventorying all your PHI, gathering all the data and the evidence that you need, and then assessing the different vulnerabilities and thinking of all the likelihood of your risk and your impact analysis, risk prioritization, because like I mentioned earlier, you do have to continue to make an effort to address any gaps and improve, and just show that you're making a good faith effort to maintain security and comply with HIPAA. And then going through all your existing controls, if you've one thing to consider is if you've changed your technology, or using different EHR systems, or new computers in the office, whatever it might be. If you've made some significant changes, that would also be a reason to conduct an SRA, or at least review your current SRA just throughout the year. And then the risk mitigation is, the acceptance transfer. If you've implemented safeguards based on your unique risk picture. And then documentation and reporting is also really critical, because if you haven't documented it, then you didn't do it, essentially. And you want to have that maintained for at least 6 years. Some state laws require you to hold on to documentation even longer. And if you were to be audited by the OCR, they will ask you for your latest SRA related policies, and sometimes even as far back or 3 years. And if you don't have that, then you know what can happen. There'll be some remediation and penalties and things like that potentially. And then ongoing security maintenance and just security awareness, training your team, making sure everyone understands their responsibilities when it comes to HIPAA and security, including your external vendors, like your business associates, like a billing company. They all need to be on the same page, and you'll want to review your business associate agreements. But when you do your security risk analysis, it will cover all of these things and everything that is essential for HIPAA compliance. And so it is it's a comprehensive effort, to do it properly. So just keep that in mind. Go to the next slide. And why does it matter? It's not just for compliance, a checkbox. We keep seeing these headlines, and it's with the AI technology being used by for actors now, and just the more interconnected devices and all of that coming together. It just these continue to happen. And so, of course, when you do conduct your SRA, you're able to find problems if they are hidden. And also, I would say your network vulnerability assessments, which we could help you with. You really want to make sure that you're addressing all of your all the technical, physical, and administrative areas. Um, and here's another good reason if the breach or cyber attacks isn't enough, is that the penalties are very stiff, and you really do not, it's not just the financial losses. If you do have, if you're found that you haven't done your SRAs or anything like that, the OCR will also require you to, they'll observe you essentially for a few years. It could be 2 years or 3 years where you're having to jump through all these hoops and be in touch, and you don't want them looking over your shoulder. And they continue based on whenever we see these enforcement activities and fines. One of the key things that stands out that they all have in common, or most of them have in common, is that they didn't conduct a security risk analysis, which could have helped them avoid this a breach or ransomware attack in the first place. Here's another one. This is pretty significant. And again, the failure to conduct a thorough risk analysis, um, and not having the sufficient security measures. Had they done that, they possibly could have avoided the hacking. And just seeing these cases, that it's pretty clear what the message is, that the OCR takes it seriously, and that you need to have active, documented, repeatable processes, and that it's not just a checklist for compliance. There's real risk involved if you don't do that. And then, because of what we've seen in the headlines, there's been some changes or proposed changes. There was a bill introduced, essentially making the legal aspects of compliance enforceable, increased civil penalties, user fees to support data security oversight. This is just one of them, but even the legislators are taking it seriously with these increases in breaches. So there were also proposed changes to the security rules. So when you think of when the HHS has proposed something like this, they give a period where the public can comment on what is in it. And after that point, then I would say they end up implementing them. And so the notable changes on this is that there's the removal of the distinction between the required and addressable implementation specifications. So when in the past you could say, we're not doing this because of this, and we don't feel like the risk is very high or something like that. So then you'll actually have to address all of these things. And then, of course, enhanced documentation, more improved incident response, a variety of different things, essentially making some things, I guess it's going to be more prescriptive as far as what you need to do. I would say that's a big one, as far as like mandatory encryption, and also with your business associates, you'll be scrutinized more for making sure that your third parties are also compliant. And what's the message here is that security and risk management is an ongoing process. It's not just a one-time thing that you do for HIPAA or for MIPS. It's because the ultimate goal is to ensure the confidentiality, integrity, and availability of PHI. And regardless of if there's a breach or something, if it's a business associate or a covered entity, even if it was on the third-party vendor's fault, essentially the covered entity can also be investigated and fined for that, because there was some failure as far as oversight goes, and perhaps no due diligence. And there have been cases where a covered entity was fined and audited and all of that because of a breach at, say, a billing company. And because the billing company was breached, or had a cyber attack, then that billing companies, the covered entities that they're serving, they were audited as a result of that. And then if there was a gap, such as not having updated business associate agreements in place, haven't conducted, it just brings some attention to uh, your SRA and all of your HIPAA to-dos. So at the end of the day, you need to conduct your annual SRA, and if you haven't done it this year, or you're not confident that your SRA has been done up to the standards, or you're just needing some additional help, or you're not happy with your vendor, we're here to help. We have our platform, but we also have our analysts who do on-site and virtual walkthroughs and make sure that you really do it thoroughly and that you haven't missed anything. And at the end of the day, it helps you maintain the security of your organization. And yeah, Jennifer, is there anything you'd like to add? Or
No, I don't think so. If there's any questions, obviously we're here to help you all be successful, like she said, not just in this MIPS period, but throughout the year with all things. So if you need any help, we're definitely here and open for questions.